Welcome everybody. Yeah, my name is KV General, and today I'm having Dr. Monyebodi here. She's first of all, I would like to thank her for just allowing this. I know a lot of people when it comes to ladies, I've been trying to get ladies. So a lot of ladies don't want to be on the camera. They always say that they're camera shy. But she just went, even so yeah, this is Dr. Monyebodi. She's working at Dr. Mukhari. So we're going to hear more about it. I know Dr. Mukhari is one of the hospitals that people like to ask what, how, So Doctor, this is your time. You can introduce yourself, the year, which year of internship, and where you started, and your name.
Okay. Hi everyone. My name is Dr Monyebodi. So I started my first year of medicine. Or I studied at SMU, guys. I studied at well, it started out as being University of Limpopo, and then it ended up being SMU by the time I left. And then I started in 2014. That was my first year, and then finished class of 2019. Yeah, so this is my second year of internship at Dr. Mukhari Academic Hospital.
Oh, okay, perfect. So of course, like the next question is like, why Dr. Mukhari? In fact, what was your top 5? Was Dr. Mukhari one of your hospitals in that order?
Yeah, unfortunately not. Okay, so what happened is I applied. My first choice was Calafong. Okay, because I just felt like I needed a change. I still wanted to stay in Pretoria, but then I wanted just a little bit of a change. Yeah, but anyway, Calafong didn't work out. So, and then I was able to swap to Dr. Mukhari Academic Hospital from another colleague of ours. It was Calafong. My second choice was, I think, was Larato. Oh, can you hear me?
Yes.
Okay.
It was a bit shaky, but now I can hear you.
So it was. Okay, sure. So my first choice was Calafong. My second choice was Leratong. And then my third choice was JST. My fourth choice, I think, was Witbank. And then my fifth choice was Polokwane. Yeah, so I got JST the first time around. And then I was able to swap with one of my colleagues to Dr. Mukhari.
Wait, I missed the part of why did you carry the swapping? Like, why did you swap?
Oh no, I swapped because I have a family. I have a husband and a child, so I had to swap because my family lives in Pretoria.
Oh, I see. Like, your main one was like Calafong because you'd be around, but you had.
Yes, I'll be around Pretoria.
Oh, okay, perfect. So how is George in terms of now? This is your second year. What can you tell us about the rotations? I believe you've done most, if not half of the work, in terms of the rotations in that order you did it.
Okay, so I've done. Okay, so Dr. Mukhari is, I don't know if you went to SMU, so you understand what Dr. Mukhari is all about. It's an academic hospital. So you have seniors on seniors on seniors. Okay, so let's start with the hierarchy. We start off with the students. Yes, the students are there. We count them. So you start with the students, and then you go to the interns. And then, okay, this is from below to higher up, right? So we start with the students, and then we have the interns, and then we have the MOs, right? MOs, and then we have regs, and then we have consultants, and then we have super specialty consultants, and then we have professors, I guess. So that's like the end. So you have all of that. You find all of that in Dr. Mukhari Academic Hospital. Okay, so I don't know where to start. Where should I start? With the living situation, with
No,
the
with the
like which
rotations.
gets with
With the
the
rotations. Yeah.
with the rotations.
Mhm.
Okay, so the rotations go like this. Ne? You start with 3 months of okay, let me start with the ones that I did already. I did
Yeah.
3 months of internal med, 3 months of general surgery, 3 months of what do you call it? Was it pediatrics? And 3 months of obs and gynae.
Mhm.
So for the program now, the state program for the country now is that you do all those major four what you call it, the major four blocks the first year of your internship, and then the next year you're going to do family med for 6 months, and then you're going to do 2 months of psychiatry, 2 months of ortho, and 2 months of anesthesiology.
Oh, okay. And the 6 months, of course.
And
Yeah.
then I've done psych, I've done, yeah, and the 6 months is next, is the next block. So up to June, then we're going to do 6 months of family med, which is longer than anyone had ever expected, but it is what it is.
Yeah, no, I
Yeah,
think
so
PhD is important. Yeah, yeah. Yeah, no, continue.
yeah. Okay, so we have internal med, right? Let me just start with the ones that I remember. Okay, so internal med, it's yeah. Hey guys, I don't think internal med is nice anyway. It was busy. Oh, it was busy, guys. I don't want to lie to you. So the what you call it, day to day, right? It depends. You have 4 units in the what you call it within internal med, and then all the interns are spread out between the 4 units. And then depending on how many you are, like it depends how flexible you will be. But let's say day to day, you have to see your patients, right? You see your patients every day. You do all the investigations, you take bloods, you put in catheters, put in CVPs, sometimes even manage patients, like if your senior is not around or, but yeah, I think there's room to grow. If you always put yourself out there, then then you'll be able to learn a lot, especially if your reg is also cool and stuff within the unit. So yeah, I think I got to learn a lot during internal med, because I just put myself out there. It was my first blog. I knew I was happy to be a doctor, you know.
Yes,
Yeah,
yes.
so I was learning a lot, the most that I could. um yeah, and then the calls, the calls were, yeah, no, the calls were deep. They were so busy. So you see, pretty much 36 is closed now. There's a ward called 36. I think all the students will know it. So usually that's where we see all the incoming patients for that day. Your senior is supposed to be in casualty, seeing all the patients from casualty. And then he admits the patient or she admits the patient, and then the patient is sent directly to 36. In 36, we do everything. We manage the patient. If you have a problem, we call our senior. Yeah, we always have our rages like close by, and they're always available. For me, I didn't have a lack of the presence of my seniors around, always there to help you. If you can't do a LP, if you're struggling to restrain a patient, if you're struggling to do anything, they're there. You do learn a lot. And I think a tip for everyone is just to make friends with all the sisters, because they can make or break or break your career,
Yes.
honestly. So no, seriously, no, and you need them. Honestly, you really do need them, especially in something like that, in internal med. You do get like, maybe there were 1 or 2 times where I got like 2 hours of sleep during call. But yeah, it's tough, guys. It's tough there, especially when the people decide whether they want to have DKA, all of them, and you have to
They
take
decide to go to the party
hourly.
on the weekend and drink and
Dude,
eat
all of
cake.
them, all of them just decide. Yeah, they just decide. So for us, it was, I think it was February or something, or January. Like everyone, every day there was a DKA. So that one, and you have to take hourly like gases. Yeah, it's tough. Yeah?
Mm.
And then next up was general surgery.
Yeah, yeah.
So general surgery, It's also very, very busy.
Mm,
There are so many units. Some units don't take interns. You know, you're not going to experience everything. Some units they do take interns, but maybe they take one or two. Like you're spread out between the other units, and then okay, depending on your regs and also your consultancy, depending on those people, that's how much you're going to learn from general surgery.
mhm,
And about the doing the surgeries yourself, it's not so much. You're mostly handling the patients in casualty, especially during calls. You're handling the patients in casualty, and then sometimes you go to surgery, and then you help out. Especially Prof. Koto always tries to push us to do the what you call it above knee or below
amputation,
knee
yeah.
amputation. Yeah, he wants you to actually experience that so that when you go outside, you at least know where to start, or how to actually, like, what's going to happen during the procedure. And then, yeah, it's busy. There's so many patients there, and the calls are up and down, up and down. Yeah, I wouldn't say they're all totally like internal med, like
Mm,
busy,
mm.
busy, busy, but yeah, they're so, but like it depends how bad it is that day. And then there was pediatrics, ne?
Yeah.
So now, guys, personally, pediatrics, for me, pediatrics, I don't know. I just don't like that thing. I don't like kids.
Yeah. But it
So
really
of
does
course,
make sense. So
for
you're a
me,
mother, and you don't like
oh,
kids.
I am. No, no, it's even worse now that I'm a mother, right? It's
Yeah.
worse because when I see sick babies or I see sick children and I see the social issues that they come from, it's too much for me to handle. You understand? And I don't want, I'm always like, what you call it? I'm always thinking, oh, what if this could have been my baby? What could have been, like
Yeah.
it's hard. It's really hard. Yeah. So pediatrics is it's counted as a more chilled block,
Mhm.
but the calls are up and down. Like you couldn't really say that the calls are busy, busy, busy. There's days when they're busy and there are days when they're not busy, right?
Oh.
So in George Mukhari, okay, when I was still busy with it, they had what you call it? They had like a third on call. A third on call, you like literally just handle the wards when you're third on call. You have a reg who's a third on call as well. So they call you. Sometimes they even call you from ward 29 of a patient that what you call it, a baby that was just born that is failing to breathe or something, or
Mhm.
to you need to resuscitate. They'll call you there sometimes, and then you have to take bloods of all the babies. Oh yeah, and the drips, guys. You
I
must
wanted to
learn.
ask about
You
that one.
must
I wanted
learn
to
now.
ask. Yeah.
Please learn now.
Mhm.
Yo, please learn now because for us, at the beginning there, guys, it was a crash course. I remember it took me the first time I took bloods from like these newborn twin babies. It took me like 3 hours to take bloods from those two children, from those two
Yeah.
neonates.
But I've seen others taking them from the posterior fontanelle or something like that, somewhere there. Um,
Yeah, but it's dicey with that, né? It's a bit dicey because sometimes you can cause more damage than good. And they also like they don't really encourage you to do it. Yes, it's fast. Don't get me wrong. Like once I figured out, that's before it was my first call.
yeah, yeah.
And then I didn't know. I knew you could use the posterior fontanelle, but I didn't really know like the procedure as to how to do it, like aseptic, like what should I do.
Hmm.
And I didn't want to kill twin babies, so I just tried my best on their little hands.
Hmm.
I did. I tried my best. So I remember I took 3 hours. Even the sisters were worried, like, how, doctor, what's happening? Are you okay? I'm like, I don't know what to say. Like, I can't even call my senior because I mean, I need to learn this,
Yes.
right? I need to learn it by myself. But pediatrics was, yeah, it was one of the, you understand what I've been through hell and then I come to peds. So it was a little bit of,
Hmm.
more chilled. Yeah, and I guess so. The only problem with peds was for me was the social issues. The social issues you're gonna be fighting every day. Um, yeah, guys, there are sad situations out there, like children who are neglected, children who are, ah, yeah. It's just
Oh,
so many things. Like they just leave children there, and then the hospital must take care of them. So yeah, it gets
yeah,
to you a bit. Yeah.
it's very sad. It's
Yeah,
very
it
sad.
does. And then, yeah, it is. And then there was obs and gynae. Hey, hey, where do I start?
Yeah, no, that one,
Okay, guys. So, so obs and gynae for me, ne, it was in, that time, December, it was September, no, October to December.
mhm.
So we were dealing, oh yeah, guys, guess what we're dealing with 2020, right? Remember that. It was our first year. 2020 just happened. Internal med for me, I didn't get to experience a lot of COVID-19 patients, right?
Mm, mm,
Because it was just like we finished just before like the whole lockdown, level 5 lockdown. So I
mm.
didn't get to experience like COVID-19 as part of internal med. I experienced it as part of general surgery and it was also still a bit like fresh. So we were still having meetings and then we had to stop them. And then there was a lot of drama and a lot of us got COVID-19 after Gen Surge. Like, yeah, no, it was just a lot of problems there.
Mm.
But then COVID-19, remember the level 5 started at like March.
Yes.
So pretty much everyone got pregnant. Yeah. So everyone got pregnant around and then was giving birth in December. So guys, hey, yeah, no, I know
Yeah.
the cause of fire. Yeah, no, the cause of fire. I don't want to lie to you. The cause of fire,
Waking.
even
They were
covering.
waking. But what else can you
No,
do? I mean, you're
no,
not waking, you're not doing anything. What else can you do? What else can you do?
yeah, what else can you do? What else?
Yeah.
Yeah, so but and then our clinics were also very, very busy. Okay, we have 4 units there as well, ne?
Mhm.
They separate you into the 4 units, but the unit that I was in like was very busy. I remember our first clinic day, we worked until, was it like 6:30? I think yeah, we knocked off at 6:30,
Mm.
like the last patient. Yeah, we saw at 6:30 in the evening.
And
So
you're
it
expected to
and we
come
started at
the
8
following
o'clock.
day.
Yeah, 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 yeah. You are. Like we all have different days of clinic. You go to clinic and then you also go to the gynae clinics on the days that you're on call. So some people are assigned to the gynae clinic. You go see patients, yeah. And then your regs are always there. Regs are always there, and your consultants sometimes are there, sometimes not there. It depends on which unit you're in. But you always have a senior with you. And
Mhm.
yeah, you consult them pretty much with everything, especially with obs and gynae, because there's so many litigations. So that's where we learned, you need to write down your notes properly because any sort of mistake, then hey, you might be
Yeah,
in
yeah.
the line of fire, especially when you're looking for someone to blame. Yeah, so we did that. Obstetrics was very, very busy. I don't want to lie, it was very busy. And then also half of your block, you're going to do again, 1 month and a half, you're going to do obstetrics. And then the other 1 month and a half, you're going to do gynae.
Tiny.
That's how they separated. Yeah. So yeah, it was busy. It was really busy, but you know what? We got over it. We got over it.
Yes. Yes.
Yeah, it's
Just a
fine.
question. In terms of the ops, like a lot of questions have been like coming from the part where do they allow you to cut? I mean, you are there with registrars,
Oh
fighting for
yeah.
something to cut
No,
and
yeah. No, they do. They do. Sometimes you even book your patient before. Like if you know that your patient is like mostly emergency patients who it's their first cesarean section,
mhm.
definitely. Or if they've had like one previous C-section and then you also want to go and try your luck, they do allow you. They do. Like you just need to talk to your regis. Yeah, because I know a lot of people did more than 10 C-sections. But Luana, that's the thing. You have to go out there and be like actively like, no, doctor, the next one I'm going to do. So you assist mostly. You have days, your specific days to go to theater as a unit. And then on those days, you're going to rotate as interns. You're going to be like, okay, you do it this week. Next week, you're going to do it. And then some days, sometimes you have like twice a day, twice a week. I remember our unit, we used to do twice a week. actually cesarean section. So we would spread it amongst ourselves as interns. But you as an intern have to be proactive about it. You have to be like, no, doctor, so and so, can I please go and can I please cut? They do allow you, Shem. They actually quite chilled about it. They like they know that those are the skills that you need to have before you go to, if you go somewhere rurals and you're expected to do it, you do it.
Oh, okay.
Yeah.
I see. So, like, I
Yeah.
just wanted to ask in terms of the obs and gynae, when you get there, do you assist with labor, like since they're nurses, like we're doing as medical students? Do you go through that, or like you do minor
No,
things?
you do. You do everything. I remember there was this day, like I don't know what happened that day, but all the ladies were giving birth, like they in admissions.
Mm.
There's a cubicle for admissions.
Yeah, I see that's
Yeah.
the
So all the
yeah.
ladies yeah, so all the ladies were giving birth there. So you do help. Like you be proactive about it. You go help, you help with the cervix, not cervix, what you call it, with the massaging. You must massage there. Massage, you do everything,
Oh, okay.
that's what I'm saying, like it's busy, but mostly you deal with, remember, George Mukhari is referral hospital.
Mhm.
So pretty much everyone that was difficult for another, like a smaller hospital, or like the clinics, like next door,
Yeah.
they send all the patients there. So it gets really busy and you only get emergencies. Well, most of the time you get emergencies, right?
Mm.
So you believe me, you will learn, like within 2 weeks you would have known how to manage, like preeclampsia, mama, like how to even look for like those sort of signs while you're in the line and stuff. And with the rapture, what you call it, antepartum hemorrhage, postpartum hemorrhage, you know how to deal with everything. Like you are very proactive. Yeah, the cord prolapse, you're the one that has to hold. Remember, you have to hold the
Mm.
cord in while you go to like the main theater,
Yeah.
or when you go to theater. So you do like pretty much everything. Believe me, there are not enough hands like go ups and tiny. You will always be busy. There's no way that you're going to be sitting just chilling.
Oh, okay, okay. See.
Yeah, unfortunately not ops, somewhere else.
Ash?
Yeah, and then yeah, so I think second year is more chilled. Yeah. It's more chilled like compared to last year. Last year was deep, guys. I don't want to lie. Like if we saw flames, proper flames.
No, those are heavy
Um
blocks, eh?
Yeah, they are. But I think for us, it's better because it's only like we have 1 month off. Remember the others, the older ones, they did it for 4 months. So imagine doing like general surgery for 4 months or pediatrics for 4 months. Hey, guys, no, they were suffering, these people. Okay.
Mhm.
And then we have what did I start with this year? Let me try to think. I started with ortho,
Mhm.
yeah, orthopedic surgery. So orthopedic surgery is okay. The calls were bad because I think we just opened again the country after Christmas and all those things.
Mhm.
When we went back to ortho, yeah, it had just opened. So trauma, you see a lot of trauma patients,
Mhm.
a lot of broken bones. The calls, there were some days that were busy and some days that ah like there were no beds. You understand? There were no beds, and also January we're also we're fighting with COVID-19 as well.
Yeah.
So there were no beds. Like they didn't have wards to admit patients. Like literally, we'll have patients will be like, who we would usually like take to theater, like as okay, emergencies they did go to theater, but then like the times the patients will actually stay in casualty like for 4 days, 3 days.
Mm.
You understand?
Yeah.
Yeah. So
That's fine.
yeah, it was bad. It was bad. We didn't have like lots of space. But it was the calls were busy. Yeah, they were busy. But I mean, it's a good environment. It's chilled compared to body obs and gynae last year. But during the day to day, you have to see all your patients, and depending where you are, the unit that I was in, it was how many units? I think it was 4 units as well, 4 or 5 units that you are allowed to be. Units like spiny, they don't allow interns because I mean it's way above us. And even when you find a patient with a spinal injury, C spine or T spine or anything spine, you immediately call your senior. Because I mean, we don't know, like it's above our heads, sharp.
Yeah,
And then
yeah.
you do present. Sorry, you present after every call, you have to present your patients. But if your call stays within the week, so let me tell you, what you call it, the people who are on call on Sunday are gonna present on Monday, and then the people on Friday don't get to present because I mean it's a weekend, and then like it goes like that. So the last people to present are the ones who are on call on Thursday. They
Oh.
present to yeah, everyone, you to Bo Prof, or like Prof Golele, you're gonna present to the whole like what you call it, the whole department, and your ridges. And yeah, it's okay, but they do ask you questions. They ask, you know, Prof won't let you shame. Won't leave you, won't leave you alone. They ask you, yeah, even as an intern, they do ask you questions. So yeah, you have to read up like but the regis will tell you what to read up on, and especially they know like which ones they like asking about, especially the emergencies. Yeah, so they ask you those things. Yeah, but also I mean there was nothing that specific about it. Yeah,
How
it
long
was
was the
just
rotation?
it was okay. How long was that?
Rotation auto.
It's 2 months.
Oh,
two
2 months.
months
Oh, okay.
Yeah. And then my next one was psych. So psych, guys, I know a lot of people are afraid of psych, but guys, nah, I don't know. The patients entertain me, Shem, all the time. I like them. They're
Yeah.
so entertaining. They're happy, man. But happy, but well. So yeah, it's 2 months. It's the most chilled block. I
Mm.
think it's the most chilled block.
Even the calls.
Except for I think, yeah, no, the calls. They have their days, ne? They have their days. There was a time. Okay, so they say the peak time, ne? The peak time for psych patients is around, April, around the long weekend, yeah, April.
Mm.
Yeah, there's a lot of like psych patients that just, yeah, they just come to the hospital. So
I thought
around
it
that
was
time,
September.
yeah, even September,
Yes.
it's April. It's two times in the
Mhm.
year, so it's April and in September.
Oh,
So
okay.
it's very busy. Yeah, they even tell you, the registers even tell you, okay, around this time, Shem, it's busy. It's really busy. I don't know. It's like they all talk and they're like, okay, everybody have a psychotic psychotic episode today. Yeah, it was busy. It was busy that weekend. I was on call that weekend, so it was busy. But I mean, the problem with it is the long clerking format and the
Yeah.
25 pages. You have to ask everything. Sometimes the patients won't talk to you. Sometimes they are selectively mute. So that one is a bit difficult in terms of if you can't communicate with the patient, especially if you can't get like the symptoms that they have
Mm.
a lot. But like I said, your regis will also be there for you. You see the patient before, and then you tell the reg, and then the reg sometimes they have to come and interview the patient themselves and also make their own conclusion. Yeah, but yeah, the long clocking format is the only problem with that with psych. But the clinics depends which unit you're in. Also, it's 3 units, so depending on which unit you're in, you probably finish around 1.
Yeah, yeah.
Well, for the latest for us was like 5:30 because we only had one reg, and like he had to do everything. You have to see patients at the clinic and also have to see patients at casualty. So it was a mess for one.
Mm.
But yeah, like I think you like it was the most chilled in terms of like the times. Sometimes you meet at 10, sometimes you meet at,
Mm.
like, but legally you're supposed to be at 8. But I mean, the rages were also like chilled vibes.
Oh.
Yeah, I mean, it wasn't a problem. Like, psych was nice. It's just that the patients, yeah, the patients are just entertaining, and yeah,
Yeah, I'm too
but we
proud.
like them.
Friend of Rihanna, all these
Mm.
things. Yeah.
Yeah, everything, but like they're so entertaining. Shem. I like them. I really do. And then my last one now, I'm doing anesthesiology. So anesthesiology, it's long hours. Okay, so it's back to long hours again. You have to be at work before what you call it, before 8.
Mm.
Sometimes even before that. Sometimes it depends which surgery you're doing, like
Yes, yes,
which theater you're doing. They
Mhm.
spread you, okay, so they spread you out. All the interns are between all the
Yeah.
OTs.
Mhm.
There are main theaters, and then the others like cath lab, like I did today. It was cath lab, where they do angiograms and stuff. So it's outside of the main theater, but it's pretty much the same setup. And then there's also angio, and then there's dental. Dental sometimes, I think most of the time they do. It's either you're going to help them with dental procedures, or you're going to help with, I think,
Mm.
the breast, yeah, general surgery. They have
I think
their,
within the
what you
technical
call it? They have
department,
their
yeah, I mean,
surgeries,
yeah,
yeah,
it's
at dental building.
Mhm.
Yeah, they do. Yeah, so you do help there. And then 29 as well. You also rotate between yourselves. You go to 29, obs and gynae. You give spinals. Sometimes you do GA, depending on what the emergency is.
Mhm.
Yeah, so they I think it's a lot of regs and a lot of MOs. Like currently, they just hired a lot of MOs now.
Mhm.
So it's yeah, you have seniors everywhere. Like they're gonna help you, and then you also be proactive about it. But I mean, they can tell if you don't want to learn. But I think they all expect us to learn. You also have tutorials. We're having tutorials maybe once a week with Dr. Sebatoma, and then yeah. So you talk about, like, what you call it. You talk about pretty much the important topics for anesthesiology. Is pretty much what you learned in school, pretty much what you learned in, for SMU was 5th year. Yeah,
Yeah.
pretty much what you learned in 5th year, you go through it again and again, and this time you do practically. Like you intubate patients, you put in the spinals, you like, they teach you everything, and the machines, you have to learn how to use them, what to look out for. Yeah, and but it's long hours, and you also have to do pre-meds. I don't know if you remember. So pre-meds is you see the patient that are booked for theater tomorrow, the next day, and then you see them for your senior or with your senior sometimes. Yeah, you have to just check the, the airway. You check
Oh,
Malampati
yeah,
score.
party, any allergy,
Yeah,
all
Malampati
those
score.
things.
Any allergies, any chronic illnesses, like that might change, or might what you call, hamper the your anesthesiology or something, if your
Yeah.
patient is allergic to any of the medication. Yeah, so it's just the long hours, Jim. It's long hours, like literally you do 8 to 4 every day, most days.
Yeah, yeah.
Like the days that you're off, it's,
So do you share
like,
that room, that boardroom where you put lunch, or as interns you're not allowed?
yeah. No, you go there. You, they told us to go there, but they told us no, it's time. You guys are doctors, no. So we all put our, our
Yeah.
lunch bags and stuff in there. Uh, yeah, but you know how it is. Like it's still the same. I think if it's still the same as like the sisters. You can also join the sisters cafeteria. It cannot, not the kitchen,
Yeah,
if
yeah.
you want. Like it's not you're forced to go to the boardroom, but you do use the boardroom. Like we go there now.
Oh,
Just chill, have our lunch, yeah, and talk. Or you discuss if you want, or you just, yeah, like having your lunch break. But yeah, it's just the long hours, and it's cold, come on, like I like, especially ka winter now. We're dying, guys.
yeah, no,
Yeah.
it is.
We're dying in those theaters. We're dying in those theaters. But yeah, and then so now I'm currently in anesthesiology, and then the next block, the last block, is going to be family med. So
Oh,
family med, apparently,
mhm.
I heard, yeah, from colleagues, that it's separated because I mean, George Mukhari is such a big hospital. So we have smaller hospitals that we're going to go to. So that's what they said, ne? This is what they said. They said we're going to be separated into three, those 6 months. So 2 months you're going to do in, let's say, a peripheral hospital. It could be Audi, or it could be Jubilee. I don't know if there's another third one or something. No, but I think it was two only, right? Peripheral hospital. And then for 2 months, it's going to be at George Mukhari. And then for the another 2 months is going to be at what's that thing? It's going to be at local clinic. So
Oh,
I know PD Song 4 is one of them. Yeah, PD Song 4, and
meeting
is it
towards.
Social Group 3?
Yeah. Okay.
Not KT to KT, I think is too small. I think it's Soshanguve 3 or something like that. And then there was a third one, Nokarke Tempa Clinic in what you call it? Yeah, go Hamaskran. Yeah.
Oh, okay.
Yeah.
So,
So
so
they're gonna
I
they're
wanted to
gonna
ask,
like
like,
split it. Let me
you have
see.
to move if you're going to GVD, like take your clothes, take your.
No. You don't have to move. You don't have to move. We have transport now. It's just that the transport leaves apparently at 7 from George Mukhari and then drops you off at what you call it at the hospital or the clinic, and then afterwards, like you're going, it's only gonna
Oh, okay.
hello, yeah,
Okay. Yeah. I lost you for a second.
my signal. Okay, sure.
Yeah.
So yeah, okay, but did you get the last part where we got transport this year?
Can you hear me?
Yeah, I can
Okay.
hear
Yeah,
you.
I got the part you saying you got the transport this year. Yeah, I had that.
Okay, yeah. So yeah, I think though that's the last thing. Yeah.
Oh, okay. So
We have a
I
blog.
think
I
that's
don't know if there's something else that you need to know.
no, I think you'll add that. I think it's fine for now. You'll be thinking of it. But in terms of the surrounding now, I mean, you were there, you studied in SMU, you know all this stuff. But let's go to the DQ
Yeah.
environment itself. How is it?
Okay, so the environment, like it is. It's like it's a township. Yeah, and then the DQs are like they're okay. They're habitable. Shem. Not for me. I mean, if you whenever you have standards, then yeah, it's okay. But first, okay. So first to get DQ, it was a little bit of a hassle, right? It's a little bit of a hassle because George Mukhari takes in a lot of interns. It takes in a lot of interns at the beginning. Like I think we were like supposed to be 80, around 80 interns. So they didn't have accommodation for all of us. That was the problem. And then some interns ended up like living in the nurses' quarters instead of DQ. So actually, yeah, it was a bit of a hassle, Shem, to get like accommodation first, and then the DQ. It's like they're old school, like they don't have showers. They came back, so but I mean, you have the space. You have the space. There are I think 4 different types. There's a bachelor. I know there's a bachelor, ne? And then there are single bedroom, 2 bedroom and 3 bedroom. I think it only goes up to 3 bedroom blocks. So depending on which block you are on, you have space. Sometimes what it did for us, especially because it was a big group, they made us you can let's say you take 2 of your friends and then you share a 2 bedroom like DQ. So yeah, it's still sharing, but I mean it's better than not having any accommodation at all, right? Yeah. So, I mean, they're spacious. They're spacious. Sometimes there's noise, like people want to party. It's okay. We understand that you're new doctors and all. Yes.
Yeah.
Yeah, sometimes it gets noisy. But I mean, there are also people that have their families there that, they brought their children, husbands, everyone,
Oh,
so it's okay. Yeah, it's habitable. You understand? Like
yeah.
it's not as bad as everyone says. Yeah, no, it's old school. Like you don't expect any new like countertops and
So when
but
you get there, do you find
but
anything or
it's
you just find a
habitable.
hall?
You find a hall, so you have to buy everything. You have to buy your own. Oh, it's either you take like for me, I took my stuff from Res,
Yes.
and then like the fridge and the microwave, I brought my own. And then I mean during the year you'll try and get you start with camp chairs and then you get to couches afterwards. So
They
Like,
don't give, yeah.
no, they don't give you, yeah, they don't give you anything. You have to start yourself. You have to start like collecting your own furniture and all. And then sometimes, okay, so the DQ, sometimes there's no water.
Mm-hmm.
Sometimes those are like the cons. Sometimes there's no water. Sometimes there are like there's load shedding. So what happens is, ne, the generator,
Mm.
it accounts for the hospital, like the important people, the
Mm.
people that actually need the electricity. Yeah, so the generator supports them, but it doesn't support DQ, unfortunately.
Oh,
So there are times when Otokra, it's like it's load shedding around Garankua, and then yes, DQ is like dark city, and there's nothing you can do about it. Yeah, so those are the pros and cons about the
oh,
DQ. But I mean, it's not completely bad. I mean, if you need a place, DQ is the place to be. And I mean, you don't pay a lot of money like to stay there. So I mean, for starter, it's not bad. It's really not bad.
oh, okay. Usually
Yeah.
the viewers would ask to see the DQ if you don't mind, but if you do understand, I mean, just the camera to move, like this is this,
No,
like,
I know. No, but I'm not there now. So I
oh,
should
you're not
say
there.
another time. I'm
Oh,
not there
okay.
now. No,
Oh,
currently
okay, okay,
not.
okay.
Yeah, yeah.
And the surrounding, like, if I'm hungry, where do I get to buy the food? Where do I get to, have fun? You know?
Okay, so guys, gotta get a fabulous. So there are many places where you can buy like the plate, uneni cafe, mamanko, like just up the road, uneni di chisanyama. So
Mm.
there's this new chisanyama I just figured out. Like a colleague of mine took us there.
Corporate.
That was cop rep, yeah, that one. I guess that one was dope. And the food was good. The food was
Yeah,
good.
yeah, it's
And they're
nice.
proper cheap. That's the nice thing about it. Oh, they're cheap. And but apparently the weekend on any vibe equally. So I'm definitely planning to go there sometime soon.
Yeah,
But I mean there are lots of places. And there's also just down the road, just before you came, there's a corner, I think the new Garangua or
oh,
Garangua
lifestyle.
extension versus XX extension versus,
Mhm.
yeah, that side. I saw there's a nice place there where like a club sort of thing. But I mean, like as Kikasi, so you get food, right? If you want, I don't know, Rivita Chile, like, I mean, you must just be strong over there. So you buy food like outside. you,
Yeah.
you buy food outside. There are kiosks, those people that are selling food outside by the taxi rank there.
Mhm.
They sell like plates, they sell there are multiple things like snacks, they sell everything, ne? But then I mean we don't have a specific cafeteria inside the hospital. We have a tech shop, and they sell what department, like they're limited. It's a small thing, snacks, whatever you need. But then usually we go to Galitos. If I mean right now, if you go to campus, if you go to SMU, yeah, you go to Galitos, we buy food there. Yeah, I mean, it's in terms of food, that's what you get, guys. And then,
Yeah.
the nearest mall is Wonder Park. Everyone knows it's like maybe a 10-minute drive, 10 to 20 minutes drive away
Yeah.
from Arankua, which is the nearest mall. And they have pretty much everything that you need. They also deliver sometimes at the hospital. Like you call them and they deliver at the hospital. So you're not really stranded in terms
Mhm.
of like food. Yeah, but I mean, that's all you get. Yeah.
No, I think it's nice. Those who do not know it by then when they come, they'll be highly informed. But in terms of safety and security, I like doing.
Mm.
If I don't know the place, it's a kasi. Should I be worried?
I mean, guys, it's South Africa, guys. I mean,
Yeah.
everyone is worried. So I don't know what to tell you with the safety. Safety, I mean, I mean, we haven't had like so many like incidences where like I don't know people are hijacked or I don't know. Not that I've heard of. I haven't heard of anyone like having any troubles like that or someone breaking into their car while on camp, while inside the hospital. So I like to think it's pretty secure. I see a lot of us like running around the inside, like who are exercising. I think I judge a place by if I see people running around, then I see okay, no, people are free here.
No.
Um, yeah. So, and I haven't heard of anyone breaking in, anyone lost any sort of property, especially go DQ. I haven't heard of anyone like losing their stuff. So now for me, it's pretty much safe for me. It's been safe. And don't provoke law and don't provoke things. I mean, by driving outside late. We are close to like the notorious like hijacking people like Sosha,
Yeah.
like it's known for hijacking and stuff. But I mean, if you avoid like certain times, don't drive around alone and always like make sure that you don't take certain roads. Like I heard the N4 they have spikes and stuff, but try to avoid such roads and stuff when you're driving, especially at night. Yeah, I mean, but for me, I haven't heard of anybody being in sort of crime related like problems. I haven't heard of that. I haven't heard of that.
Perfect. Perfect.
Yeah.
So it's, I hardly had ladies on my interviews, and I think this is very important. You are a lady that age.
Yeah.
How is do you conduct yourself like when you're working as an intern, the seniors, taking chances? Like how do you shy away from that? How do you conduct in terms of that? Or have you experienced such?
No. Dude, I think we experience it, like women experience it everywhere. So I think it's gotten to a point where you're just used to it.
Mhm,
And then, I mean, you just remember to remain professional.
mhm.
I mean, if someone just tries to go overboard and then tries to put you in the wrong place, then you just tell them, no, I'm sorry, like I'm here to work. So if you're here for something else, like suit yourself, Marana, I'm here to work, and you just ignore and move on. Like, don't worry, nothing bad is gonna happen to you. I think you just need to be assertive, or sometimes you just laugh it off. You just like, whatever, dude, like whatever you say, but don't take it too seriously. Like, don't take it to the chest. I think
Oh,
there are a lot of dude, I think I've had so many instances. They're always like trying to like take chances and stuff, but I'm always like, dude, now I'm here to work. And you always tell yourself, you know what, you have to have boundaries, not just like me as a woman,
okay.
but also the males. Like as an intern especially, sometimes like your seniors will take advantage of you. They
Mhm,
will try and make you do things that like you're overboard. I mean, your time is, especially if you're not on call, my time is from 8 till 4. After that, I really try not to answer my phone, especially if I see it's someone from work. I really don't try to be always like available, you understand.
mhm.
Always have your limits, otherwise that's what learns to burn out. I know you're supposed to be enthusiastic about it and all, but they're not supposed to like really take advantage of that. So I really keep it professional. I only answer my phone during 8 and 4. And after that, I don't talk on WhatsApp. Like, they're always gonna have your number. I don't
Yeah.
try and talk on WhatsApp, the reply messages, like I always have time. No, you don't have time. I also have a life, and you need to have boundaries. I think that's the only thing about it. You also have to have boundaries and need to tell them. Also, believe me, if you remain professional, they will know, okay, this person, I'm not going to try to take chances with her. I'm not going to try to take chances with this intern, because I know after 4, you'll never find him.
Perfect. Yeah.
Yeah, you
That's
must
very-
have you. I think you must. Everyone must just have their own boundaries, especially as an intern. Otherwise, they're gonna take advantage of you, and yeah, that's not a pretty sight. Believe me,
Oh, okay.
it's really not. You don't want to see yourself like right now, me answering a phone call from my boss and be like, "Oh, okay, like what was I supposed to do?" Like they'll call you now at 8 o'clock and be like, "No, you can you please go do bloods for me?" And I'm like, I'm not on call. Then they're like, "No, don't you live at DQ?" No, I
Yeah.
don't live at DQ. Me, I don't live at DQ.
Yeah. Yeah. Mm.
So, but I mean, of course, yes, there's some rages that you do get close to, especially, I mean, after 3 months, you do get close to them and you're like, you know what, it's fine. I don't mind doing it for that specific person, but doesn't mean something else. You just remain professional about it. You understand?
I get
Always
it.
remain professional. Always remain professional. Don't try and joke around with these people.
Oh,
We are here to work, and we're
yeah,
here for the
definitely.
patient.
Definitely.
Mm, yeah.
In terms of you now, I think it's sort of interesting that you have a family already. And,
Mm,
there are those that already now, in your finals, they've got maybe pregnant or have a kid, have someone serious.
mm.
What advice would you give them? I mean, those that have a family already or going to be maybe next year.
Going to be okay. So for me, ne, I honestly had a good support structures. Like I won't lie. Like my mom came through for me. Ne? My
Mm-hmm.
mom really took care of my child
Mm-hmm.
while I was busy. What you call it, studying. So I remember I gave birth. I think during my final year.
Mm-hmm.
During my final year. Um, yeah, can you hear me? Okay.
Yes, I can. I can.
So yeah. So I just keep pushing. I think because I literally took 1 week off, and the 1 week off that I took off, it was because they were striking, and I gave birth around that time, and then I took the 1 week off, and then I went back to school. Although it was hard, it was hard, hard. But I mean, I had to make that sacrifice so that I can finish, and so that I can carry on with what you call it, with my internship.
Mm-hmm.
So during internship is going to be very hard, especially the calls. The first year of internship, you're always going to be busy. But I think for you, if you have a family and if you can afford someone to come and help you, I mean, sometimes they don't cost too much. You can try and have your family live with you, especially if you're very close with your child. Or for me, I had, like I said, I had support structure. So my mom is the one who took care of my child during the time. And yeah, I look, just keep pushing. Pregnancy is as illness, ne? Pregnancy is not an illness. You study in between, you study, you carry on. Your child will be your degree as well.
Yeah.
Look,
Big
you have
degree.
this MPCHB together.
Yeah,
Okay,
two
yeah, you
degrees
have
at
it
once.
together. Just keep,
Mm.
yeah, you have 2 degrees at once. You just have to keep on pushing because I think if the more time that you try and take off, the less time you have to finish. And I always like to finish like on time. So I really push to make sure that what, I need to pass my final year. I need to go through this. It's better for my family at least that I have a salary. So that's why I said, like, you just push. You don't have like any chances now because you're thinking about the future. You're thinking about your child now. So you have
Yeah.
to push to get to that degree and also start earning a salary so you can start saving for your child's everything and carry on. Hey, crash nowadays is expensive, guys, like 3,000. Oh my god.
Mm.
So yeah, you have to push so that you can afford these things and you don't have to, pretty much hurt your parents in terms of like them taking care of your child, taking
Yeah, yes.
yeah, but
And you're
yeah,
the
I would
best.
really suggest, that you push. Your degree will eventually help you in terms of, everything else.
Oh, okay, perfect. So I think we've come to the end of this. But I'll just give you the opportunity to say the last words to the guys who are becoming interns next year, and also those that are still in the junior years, fifth year, fourth year, going downwards. What will be your last words to them? Then we close.
Okay. Okay, so my last words would be okay, I don't know if I'm talking to someone or I know some people are not like Christian, but I would say in whichever higher power that you believe in, remain in it. Prayer changes, guys. Prayer changes. So please stick within your higher power, believe in your higher power, but also work hard. Work hard. Make sure that you learn as much as you can, especially during your school year, because now they keep asking us about everything like in internship. You're supposed to know this, you're supposed to know that, and you're fresh from, they're gonna be like you're fresh from taking physics and then physiology and
Yeah, yeah.
anatomy. I'm like, I'm fit, I'm not fresh, I'm not fresh. But you understand, like you need to work hard, you need to work hard. And also remember, there's a change, when you become a doctor. There's also that thing that, what, like, I've worked hard, but
Mm.
don't let it get to your head. Always make sure that you talk to your seniors. Never do anything by yourself, especially as an intern. Never do anything by yourself. Always have correct notes. Always make sure that you know like what's happening with your patient. And yeah, don't be afraid to ask for help, guys. Like, even if it's from a sister, like I know I ask sisters a lot for help. Don't try and be above them, you know, work with them because they know more than you do, Shem, sometimes, honestly. So guys, it's you know, internship, it's got its up and downs, but I mean, altogether you're learning. So always strive to learn, always strive to learn, even if you don't like your rich, even if you don't like your seniors, just strive to learn from your experience. That's what I would ask, because community service now, you are MO, you will be left alone. So always strive to learn. Even if you don't like that department, strive to learn. Wherever it is that you are, strive to learn. Always push to learn and always remain professional. That's my takeaway message. Always remain professional.
Okay, I think we've come to the end of our session. Just one last thing, in terms of George Mukhari, would you say someone must avoid it, consider it, shortlist, or just go for it? What would you say?
Okay, so for me, it depends. It depends what type of learner you are. If you know that you are more independent, and then you don't want someone looking over your shoulder all the time, then I would suggest that you go to, like, you know, a peripheral, another peripheral like hospital. But I mean, if you also, depending on what you want to learn, what you want to specialize in, if you want to specialize, um, I would suggest Dr. George Mukhari Academic Hospital is what you make it. You understand? You have everything there in your hands. Like, you could learn the most, honestly, if you decide for yourself that I'm going to learn. If you take your, you know, that step forward to learn. But I mean, but for me, if you want to be more independent, I would suggest you go to a smaller hospital, because they, you don't have a lot of, you know, guidance. You literally just thrown in at the deep end and you have to swim. So here you have, you know, a lot of people who are looking out for you. You never do anything alone, but there's also a lot to learn because it's a specialty hospital. So you see way more different things than what you see in the peripheral areas. You understand? So it depends on you, what type of learner you are and what you want to do for your future. If you want to specialize in something very like highly special, then you will definitely be suggest. I will suggest that, you know, you go to an academic hospital, because that's where you're gonna find that specific thing that you want to specialize in. And then, you know, you see yourself. If you see yourself there, then you can imagine it. But yeah, and each to their own. I wouldn't say I would suggest it all completely, but I wouldn't say I would scrap it off like completely. It depends on you. It depends on what learner you are. Yeah. Yeah.
Okay, thank you, Dr. Modi. Thank you for this opportunity, and thanks to everyone who tuned in. So the video will be available on YouTube on KV General channel, then and that's all. So without, do we have any questions before we leave, guys? Do you have any questions there on the floor? If you don't have any questions, then we are signing out. So you can just raise your hand. You can just ask straightforward. So you guys decide. If you don't, I think we'll just close it. So yeah, thank you, Dr. Modi. I think I really appreciate your time, and we're looking forward to, probably if we come there, we'll be calling you there. And in terms of your handle, if they want to, if they want to find out more about you, so where can they, you know, if they're interested?
Oh, okay. So my handle is at Mantiping, man the ping, in Instagram.
Oh, man the peng. Yeah.
Man the ping. Yeah, pretty much. That's how you spell it. So yeah, I'm on Instagram. Okay, I wouldn't say Facebook. I am on Facebook, but I'm hardly ever active there. So mostly I'm on Instagram. Yeah. And then if you want to, you can just DM, I guess.
Oh, okay, perfect. So thanks for your time, and I'll be signing up the meeting. Thank you, doctor.
All right, sure.
Thanks
Bye.
Bye bye.